Oh, thanks so much, Alyssa. And what a pleasure it is to be with you today. And thank you so much for inviting us, and especially on this topic of the social determinants of health. It is definitely the direction that the hospital community benefit programs that I work with every day, the direction they are going. I know it's the direction that you and other health departments across the country are going in. And have been really pleased to see it's the direction that our physician colleagues are going in. For a couple of years now, the Academy of Pediatrics has advised all of its practitioners to screen for the determinants of health. I know for many years the OBGYN community has been looking at screening for violence prevention. And just last week, there's a wonderful policy paper by the College of Physicians, those are the internists, on the importance of the determinants of health. So we're so pleased because that's the direction we're going. But why are healthcare systems concerned about this issue? And I'd say there are three main reasons. One is that we are increasingly being looked at in terms of our quality, but also our reimbursement, not on the volume of services we provide, but on the value that we present. So we're much more accountable for patient outcomes than we had been before. Not just what we did, but what good did it do? And when we look at how can we improve patient care, we really have to go upstream and look at those determinants of health. When our clinicians see a patient, there's so much they know about them. You know, they've got the physical exam, they've got the medical record, they've got all the lab results and the scan results, but there's a lot that they might not know. They might not know that this person runs out of food at the end of the month. They might not know that this person doesn't have a refrigerator to keep the insulin. They might not know that this person faces violence, either emotional or physical violence, almost every day. And all of those things impact their health. So what we have been looking at is these are all what the CDC, Healthy People 2020, calls the social determinants of health. And I know there are other terms, community factors, social risk factors, but we call them the social determinants of health. And as you probably are well aware, it includes economic stability. Poverty is probably the number one issue that can poorly affect the health of our populations. But food instability, not having enough money to have healthy food. Housing stability. We know if someone doesn't have a stable home, a healthy home, it's really impossible to be healthy. Being employed, what their income is. Someone talked today, is it a public health issue to work on a minimum wage? Oh boy, income is so very important and critical to being healthy. But also education. I was talking earlier with someone involved in the nurse family partnerships, that we know early education is so vitally important to health, because if children aren't ready to learn when they go to school, the chances of them hitting that next milestone, which is being able to read by the time they're in the third grade, means that they really are at high risk of not graduating from high school. I mean, if you don't graduate from high school, your life expectancy is definitely cut short. And so we know, and we're learning it more every day, I think, of that intersection between education and health. Certainly health literacy, understanding what the physician and the clinician is saying about what those orders are, what they should be doing, and having the clinician understand the cultural background, the language background. The social context. I also work in the field of aging, and we know that for older people, though I think it's true for adolescents as well, that isolation and loneliness can be deadly. It's another comorbidity, just like diabetes and other problems are. If people are socially isolated, they are at much greater risk of poor health outcomes. Discrimination. Many of you probably saw the New York Times article a couple of weeks ago, New York Times Magazine article about high infant mortality and maternal mortality rates among the African American population. And as stunning as that whole article was, and depressing as the whole article, one thing that pulled out to me is when they looked at what are some of the reasons that happens, is that even when you take away some of these other social factors and economic factors, The fact that a woman has had a lifetime of discrimination, of racial injustice towards her, seems to be a factor in maternal deaths. So certainly of discrimination counts. Health and health care. Does the person have access to not only physical care, but mental health care, dental care, and a whole lot of other issues like that? Neighborhood and the built environment. We're learning more and more about the importance of the built environment, and many people I know this morning were talking about examples, working with Parks and Recreation, working with police on safety issues. Transportation. Can people get to jobs and medical appointments and other things they have to do without spending so much time away from their family? Clean air, clean water, we know from Flint, Michigan, the importance of that, and they're still studying the effects of the Flint water crisis on childhood development. And certainly access to healthy food. Well, these issues aren't real new to most healthcare providers when we look at our histories, especially to faith-based providers. But I know other community hospitals and healthcare systems as well have been engaged in low-income housing. Many of our sponsors did education, they did housing, they did healthcare. Feeding the poor goes back to the beginnings of our sponsors. Fighting racial injustice, many stories of healthcare organizations who were the first in communities to rally against racial injustice and to integrate their organizations and to prevent violence. I just want to share one story with you. A Call to Care is a book where we pulled together a lot of examples of some of the foundresses, some of those women who started Catholic health care. And this is a story about Sister Mary Reginald Slattery in Monroe, Louisiana. And she was in charge of the colored ward in her hospital. And one day a mob came to take one of her patients away for a lynching. Sister Mary Reginald just stood there in front of them. And here's how the story goes. With a cold stare, Sister Reginald held a gun in position, ready to shoot the first person who dared to enter. Noting the pistol, the members of the mob looked at one another for a few seconds and quietly dispersed. Little did they know that Sister Reginald had never before held a gun, that she had no idea how to shoot, and that the gun wasn't loaded. But that didn't stop many of the sisters from trying to be engaged in some of those issues. One of the things we realize is that we can't address the social determinants of health alone, that this is a need for collaboration. I love Brian's example today about Horton Hears a Hue being a great example of a primer on how to collaborate in a community. My favorite children's story is Stone Soup. Do you know the story of Stone Soup? Where soldiers come to a town and they're hungry and they ask the townspeople for some food, and no one can spare any because it's a very, very poor town. No one had food to spare. So they said, okay, we'll make some stone soup. Can anyone lend us a pot? And someone gives them a pot, and they fill the pot with water and put in some clean stones, and they taste it and say, well, this would be good if only we had maybe an onion or potato. And someone gave them an onion, someone gave the potato, someone gave them some salt, someone gave them some meat. And before long, they had a wonderful, rich soup together that they were able to share with the entire community. I love that story. But we know that no one sector, and Brian was saying that, Alyssa was saying that, because each of our sectors has limited resources. But I really believe in the collective action that if we work together, we can get results. But what is the role of hospitals and healthcare systems? We've spent the last year looking at that, and we've come up with what we think is a framework, and it's threefold. First of all, clinical management. That as we take care of patients, that we know what those social factors are that are impacting their health. Screening for those social factors, and then referring them to community resources when we can, but making it part of basic patient care. Secondly, as in the structure of our operations, when we operate our organizations, not only not to do harm in terms of polluting or environmental sustainability, but to do good think about the health of that community. So it's local investing, it's local hiring especially vulnerable populations, looking at maybe persons who had been incarcerated before or have disabilities or other ways are disadvantaged in the system, reaching out to them for employment opportunities. Certainly environmentally, hospitals used to be, as you may know, the biggest polluters of mercury in our communities. And mercury is just a terrible substance on the development of the unborn and on young children, and almost all hospitals have become mercury free. But we have to make sure that as we go about our operations, that we're not harming the environment. And a lot of hospitals are working on climate change. We saw just recently, CDC came out with something that said we have triple the number of tick-related and other vector-related diseases. I don't think they're going so far as to say it's climate change, but those of us in healthcare really believe that's one of the ramifications. So when we decrease our carbon footprint, that we are helping the health of the community. So when we operate our organizations, how can we have the health of communities, especially low-income communities, in mind? And then finally, community collaboration. We can't solve transportation problems or education problems or some of those others, but we want to be and should be at the table. And we can lend what we can. Sometimes it's staff expertise, sometimes it's funds, sometimes it's our voice in terms of advocacy, testifying to local ordinances. Very often the healthcare organization does have a good, loud, clear voice and can help in some of those issues. Just a few examples that I've seen lately. One, I shared the table earlier today with some folks from Kankakee, and Presence Health has developed some senior housing there by the waterfront. And there by the waterfront, I understand the city is also building up a lot of resources for people in the low-income housing area, but also for others in the city. And so Presence was part of that. There are a number of ex-offender programs going on in the country. This is one I had a chance to visit last year, and Secours has a program that includes job training, housing, counseling, and job placement for a lot of ex-offenders, and it's a very successful program. One of our healthcare systems is Catholic Health Initiatives, and over 10 years ago, their board said we want each one of our hospitals, and this is a system that's in a lot of very small rural communities, as well as some larger cities. We want each one of you to work on some aspect of violence prevention, not just treating the violence that comes to you. So some worked on human trafficking, some worked on gang violence, some worked on domestic violence, some worked on bullying, but in other ways, and this is a report that they just recently came out with. Alexian Brothers in Arlington Heights is one of 32 healthcare organizations that has the Centers for Disease Control Innovation Center grants on accountable health communities. And what these grants are doing is helping healthcare organizations screen for those determinants of health, work with community members to refer people who have findings onto services that they might need. They're just collecting information, they're implementing those programs, and we'll be monitoring them. But I think it's very exciting. Here's a story I think Jamie might talk to you about what Trinity Health is doing in Detroit, where they're building a healthy village. And not only are they providing health care, but they're doing job training, they're doing early childhood education. So they're looking at the whole gamut of services. And then this is the last example I have, which is one of my favorites, Mary's Garden in Decatur, Illinois, which is an urban garden. But it is so much more than just a garden. So it's producing healthy food, but it's also creating some jobs, some people who are being hired to manage that garden. They're working with a local community college to create some courses where they can get credit on urban farming. And it really is contributing to the inner city vitalization. So I'm real pleased to be with you to tell you this is the direction healthcare is going in, and I'm looking forward to the discussion and hearing how either your suggestions for how healthcare can work with you or some examples of what you've done.